Hello guys, welcome to Medycoding.com. So in this lecture, we are going to learn some important suffix for the surgical procedure. So this knowledge will always help you to know the procedure by seeing the term only. So our first suffix is ectomy. So ectomy means removal, and it may be removal of organ, tissue, or maybe gland, like removal of appendix. It is said to be appendectomy. Similarly, if adenoid is removed, then adenoidectomy. So here are the common use procedure, like cholecystectomy means removal of gallbladder. And this procedure is very common procedure nowadays. Other are colectomy, removal of colon. This is usually performed for cancer. So if the physician is removing an organ, most of the cause is for treatment of cancer. Similarly, hysterectomy, removal of uterus. The hyster means uterus. Laminectomy, removal of lamina, that is, the part of spine. Mastectomy, removal of breast. Oophorectomy, removal of ovary. Prostatectomy is the removal of prostate gland. Salpingectomy, removal of fallopian tube. And tonsillectomy, removal of tonsil gland. Next suffix is centesis, means surgical puncture to remove fluid. Similarly, arthrocentesis means removal of fluid from joint. Here the term arthro means joint. Thoracocentesis means removal of fluid from pleural space. Next suffix is otomy, means cutting into, or you can say that making an incision. Tracheostomy means making an incision in trachea. Okay, that incision in trachea help breathing. Next is craniotomy, procedure often done to release pressure during brain surgery by cutting in skull. Next suffix is ostomy, means creating an opening. So colostomy, creating an opening in the colon to the abdominal wall for stool to pass. Gastrostomy is the surgical creation of an opening into the stomach for feeding or decompression. Before proceeding next topic, if you want to get complete training of surgery coding with interview preparation, then click on the link and enroll for the training. We have trainer having good experience in training. So people usually get confused that what are the difference between otomy and ostomy. So otomy means making an incision to get access an organ or structure for surgery or treatment. Whereas ostomy is making an incision and creating a permanent or semi-permanent opening that allow the passage of urine, food, if natural opening is not working, such as gastrostomy is used when a patient cannot swallow safely, maybe due to coma, or maybe the mouth or esophagus is blocked or injured. So in such situation, gastrotomy is used to feed such patient. If you code for EGD, then there are two codes based on approach. If entered to mouth, that is natural opening, and other will be through stoma, means artificial opening. There will be quiz in the link of description of this video, so click on the link and check your knowledge. Next suffix is pexy, means fixation or suspension. So mastopexy means fixing or lifting of breast. So this is performed to correct breast sagging. Orchiopexy means the surgical fixation of an undescended testis into the scrotum. Undescended testes is common in premature infant. It is a condition in which one or both testes fail to descend into the scrotum at birth. Next suffix is desis. This is very important. Desis means fusion or binding. So arthrodesis means fusion of joint. It can be any joint. Spinal arthrodesis is the fusion of spinal joint. Is very common procedure of spinal. Next suffix is raphi, means surgical suturing or repair of a structure. Colpraphy means surgical repair of the vaginal wall by suturing. Colpo means vagina. So this is also important procedure in surgery for female. Similarly, other terms are anterior colpraphy, that is the repair of anterior vaginal wall performed for the treatment of cystocele. Posterior colpraphy, that is the repair of posterior vaginal wall performed for the treatment of rectocele. Next suffix is lysis, means separation, destruction, or freeing. So adhesiolysis means lysis of adhesion. During surgery, the physician has to enter inside in our abdomen. So they perform lysis of adhesion. Next is plasty. So this term has very depth meaning. People get confused. So plasty involves reshaping, rebuilding, or correcting a structure. Suppose the physicians perform the removal of breast, that is called as mastectomy, and then it need to reshape for the cosmetic purpose. So they perform mammoplasty. So mammoplasty is the reshaping of the breast. Similarly, in arthroplasty, that is the replacement of the joint with artificial component. So for knee arthroplasty means rebuilding a knee joint by replacing the damaged natural joint to artificial joint. The next is tripsy, that is surgical crushing. Similarly, in lithotripsy, litho means stone or calculus and tripsy means crushing. So lithotripsy is the crushing of the stone. This term is very popular in urinary system, like lithotripsy of kidney stone or ureter stone. So these all the common suffix of surgical procedure, the more we will see in upcoming lecture. Also, I suggest you that you should learn about some root word of medical term. So thank you.